With over 765 million reported cases and nearly 7 million deaths, COVID-19 has swept across the globe, leaving behind significant and enduring scars. Yet that is not the end of the story. The World Health Organization keeps a short list of priority diseases that could cause the next deadly pandemic. Most of the diseases are already known to us. Ebola, SARS, and Zika make the cut, but the final entry has the terrifying name, Disease X. The term Disease X is used by the WHO as a placeholder to describe a disease that's unknown to medical science as a cause of human infections, and as a new disease agent, whether it's a virus, a bacterium, a fungus, or other agent. There likely won't be any vaccines or few, if any, treatments available. This isn't the stuff of science fiction, said Dr. Richard Hatchett of the Coalition for Epidemic Preparedness Innovations. This is a scenario we have to prepare for. This is Disease X. The WHO coined the term Disease X in 2018. 1 year later, as COVID-19 began to spread across China, the world witnessed a deadly pandemic caused by a new virus. A Disease X had emerged. It is not an exaggeration to say that there is potential for a Disease X event just around the corner. Dr. Pranab Chatterjee, researcher at the Department of International Health at Johns Hopkins Bloomberg School of Public Health in Baltimore, told the National Post. The recent spate of H5N1 bird flu cases in Cambodia is just a case in point, Chatterjee added. Some public health experts believe the next Disease X will be zoonotic, meaning it will originate in wild or domestic animals, then spill over to infect humans. Ebola, HIV/AIDS, and COVID-19 were zoonotic outbreaks. However, there are other sources of diseases, and bioterrorism could be the cause of the next pandemic. The possibility of an engineered pandemic pathogen also cannot be ignored, said the authors of a 2021 article in the journal Infection Control and Hospital Epidemiology. The release of such pathogens, either through laboratory accidents or as an act of bioterrorism, might lead to a disastrous Disease X as well, and has been remarked as a global catastrophic risk, the authors added. Another possible source could be zombie viruses that have been locked in permafrost or other frozen landscapes for centuries, but are released by a warming climate. The other priority diseases on the WHO list include Marburg viruses, Crimean Congo hemorrhagic fever, Lassa fever, Nipah and henipaviral diseases, Rift Valley fever, and Middle East respiratory syndrome. To prevent and combat an outbreak of Disease X, medical experts worldwide are clamoring for an increase in funds to support the surveillance of and research into potential pandemic agents. The COVID-19 pandemic was not the first to wreak havoc on the world, and it will not be the last, wrote the authors of the Infection Control and Hospital Epidemiology article. Thus, we need to prepare for the next outbreak as soon as possible. And indeed, the journey of preparing to confront the demonic illnesses has commenced. British scientists have recently embarked on a vaccine development. The objective is to create a protective shield against an upcoming pandemic caused by Disease X. The work is being carried out at the government's high-security Porton Down laboratory complex in Wiltshire by a team of more than 200 scientists. They have drawn up a threat list of animal viruses that are capable of infecting humans and could, in future, spread rapidly around the world. Let's explore inside the highly secure research facility overseen by the UK Health Security Agency. How does the atmosphere of the battle against the looming pandemic unfold? Professor Dame Jenny Harris, the head of the UK Health Security Agency, or UKHSA, told Sky News, What we're trying to do here is ensure that we prepare so that if we have a new disease X, a new pathogen, we have done as much of that work in advance as possible. Hopefully, we can prevent it, but if we can't and we have to respond, then we have already started developing vaccines and therapeutics to crack it. The Vaccine Development and Evaluation Center at Porton Down has been expanded to take on the work. Originally, it was focused on COVID and testing the effectiveness of vaccines against new variants. But scientists at the center are now involved in monitoring several high-risk pathogens, including bird flu, monkeypox, and hantavirus, a disease spread by rodents. Live viruses will be kept on-site in specialist containment facilities where scientists can access pathogens that do not yet have a vaccine or ones where immunization could be improved, for example, the flu or mpox. Professor Dame Jenny Harris said, "What we're trying to do now is capture that really excellent work from COVID and make sure we're using that as we go forward for any new pandemic threats." She added, "What we try to do here is keep an eye on the ones that we do know. For example, with COVID, we are still here testing all the new variants with the vaccines that have been provided to check if they are still effective. But we are also looking at how quickly we can develop a new test that would be used if a brand new virus popped up somewhere." Professor Isabel Oliver, UKHSA's Chief Scientific Officer, said, "We know that through scientific advancement, we could detect and control these spreads before they have the impact that COVID-19 had on our lives. It's not easy, but we know that if we strengthen surveillance and if we accelerate the development of diagnostics, vaccines, and therapeutics, we could do so much better. We need to be prepared for all threats, including those that have not been detected yet." One early success is the world's first vaccine against Crimean Congo hemorrhagic fever, a disease that's spread by ticks and has a fatality rate of 30%. Early-stage clinical trials have just started, with 24 volunteers expected to test the jab. The disease is becoming more common in Europe as global temperatures rise, and some travelers have returned to the UK with the infection. Professor Harris said climate change and population shifts are making another pandemic more likely. "What we're seeing is a rising risk globally," she said. "Some of that is because of things like urbanization, where you may get virus jumping into humans, living close by, as we've seen with bird flu. And some of it is because of climate change, where you get things like ticks and mosquitoes moving to where it was previously cold and is now becoming increasingly warm. So this is a growing risk agenda, but it's one we can use our science actively to prevent human impact." Bird flu is currently thought to be the most likely pandemic threat. The Royal Society for the Protection of Birds says at least 30,000 seabirds have died around the UK this summer as a more virulent strain of the H5N1 virus has swept around the world. There is also evidence of limited spread in some mammals. And 4 people working on poultry farms in the UK have also tested positive, but were only mildly affected. The UKHSA has started monitoring people in close contact with birds in case it can spread without causing symptoms. The government said Porton Down Centre also underlined the UK's commitment to the 100 Days Mission, a global goal set by the G7 in 2021, with the aim of deploying a vaccine against any new pandemic threat within 100 days of identification. The Health Secretary, Steve Barclay, said, "This new centre cements the UK's global position, spearheading pandemic preparedness, vaccine development, and scientific discovery. This state-of-the-art complex will also help us deliver on our commitment to produce new vaccines within 100 days of a new threat being identified. Historically, that would be unheard of," said Professor Harris. "It would normally take 5 or 10 years For COVID, it was around 360 days. So this is a really high ambition, but for some viruses, it is definitely possible. And that has been our World Affairs for today. Goodbye and see you next time.